we decided to create this program to collaborate and partner with media across Africa to be able to raise awareness, sensitize the communities, break the silence, be the voice of the voiceless about all these topics across all Africa. And then we expanded to have the Media Recognition Award every year. It was first as More Than a Mother, a Media Recognition Award where we address infertility stigma. Then expanded to more social and wider range of social issues and health issues, like stopping gender-based violence, ending FGM, ending child marriage, supporting girls' education, empowering economic empowerment of women, breaking the stigma of fertility, we said. So all these issues. And then we said, let's have also another theme about promoting healthy lifestyle, because it's very important. It's not only important for women and women health, but also for men and for whole society.
I would like, on behalf of my board of the Media Trust, to thank the Merck Foundation for organizing this training session for media personnel. I would like to thank the resource persons who will be making the presentations and who will also be helping in the discussions. And last but not least, the media personnel present here today for the interest you have shown in the training program.
The keynote to take, the key message to take here: infertility is not a stigma. It is just like any disease that's happening today. To today's world, the infertility is among the third cause of leading diseases. The first and second one being the cardiovascular diseases and cancer. So we can see that much is being done for cardiovascular diseases, for cancer. We are already having a cancer clinic at Medpoint. We have the DDY and all the regional hospitals. They have so many of each hospital has a cardiac clinic. So infertility also should be treated as any disease. It should not be a stigma. And on the 8th of March, it was announced by the minister that already there is one infertility clinic that is operational at SSRNH hospital. And last week I was in a workshop, and the plan is for each remaining 4 regional hospitals to have an infertility clinic. And we are already working on it. We are having a registry for all the infertile ladies. And what the plan here is just to have a clinic so that we can, at present, we are already only having the female partner in our clinic. So once this clinic will be set up, we also call the male partner. So we'll have the couple with us so that we can already have a clear history and explain them what's really happening in their sexual life, so that both will understand what as doctors, what we need them, and as a patient, what are their expectations. And infertility affects equally men and women, already said. And we have to get informed and always to support your wife, because in our society, when the couples are already 3 or 4 years of marriage life, everybody, the in-laws, the society, or whatever, you are going out in a party, everybody asking, hey, how many children you have you any kids? So they feel embarrassed. So that's why we should always support the wife, because she's the first one to take it at heart. So because in depth, we don't know where the problem really lies. It can be even with the male, but nobody will blame the male partner. Always the female partner who is the one to be blamed. And again, infertility, it is a shared responsibility because both partners, the male and the female couples, they are together. So it's just like the households or whatever they are doing in life, they share the responsibility. And fertility also should be equally shared.
Okay, so members of the Merck Foundation, members of the media, ladies and gentlemen, good evening. It's a pleasure to be among you today, and I will be talking about lifestyle modifications, preventions, and early detection of diabetes and hypertension. So we'll start by the definition of NCD. What this is the theme of today's evening, and next slide please. We'll be defining what is NCDs. So NCDs are known as non-communicable diseases, also known as chronic diseases that tend to be for a long period of time, and it is a result of a combination of genetic, physiological, environmental, and behavioral disorders. So to conclude, the most important things is that it is important to prevent, detect, and give proper treatment of risk factors so that the burden of the NCDs can be reduced. And unfortunately, NCDs are posing a devastating health consequences on the overall health system. And the Ministry of Health and Wellness, in collaboration with Merck Foundation, is trying to train more medical personnel so that we are in a position to help the community, and we may prevent such diseases and such loss that is awaiting us. So healthy public policies and healthy lifestyle are the prescription to prevent and control NCDs. Okay, so this picture is a life cycle, a healthy life cycle, as we may say. So as you see, think positive, eat better, exercise often, and feel good, and you will lead a healthy life.
Mais vous allez me dire que depuis le confinement, ça a changé. C'est vrai, ça a un peu changé. Aujourd'hui déjà, nous sommes toujours dans les restrictions. Nous ne pouvons pas nous permettre d'aller comme ça sur les plages comme nous le faisions avant. Mais n'empêche, ce qui est paradoxal, et ça on doit bien se le dire parce que souvent peut-être nous sommes un peu découragés, il y a eu effectivement une baisse de ces achats. Mais paradoxalement, et je pense que vous serez d'accord avec moi, il y a eu quand même une grande montée du lectorat sur tout ce qui est online, sur tout ce qui est réseaux sociaux, de nos canaux de la presse traditionnelle.
So I'll talk briefly about infertility, defined as a failure to achieve clinical pregnancy after 12 months of regular unprotected intercourse. It is a global public health problem with about 20 to 30% in some areas in Africa, ranging from region to region, even within the same country. It can greatly affect our mental health, leading to various psychological distress and various mental health issues. Infertility stigma is a public health issue. In societies where gender roles and social status are intrinsically tied to parenthood, such consequences are intensified. We have noticed. From the graph we can see that, as Dr. Subak had mentioned, that both the male and the female are equally responsible for the infertility. So we cannot just blame the female for this.
Motion approach to eliminate the social and cultural issues. Alors, ces thématiques ont été abordées juste avant, par le docteur. On va donc peut-être se concentrer plus sur le rôle des médias aussi, mais également comment cela est perçu dans la société, mais aussi comment est-ce que cela est traité dans nos différentes publications ou alors sur les plateformes que nous utilisons.
It is very important that whatever we do, be it the media or any people in the society, as a director as well, to have a role in promoting awareness of any issues that's happening, be it social, health, environment. Our duty as a designer, as designers, is to use this platform, whatever platform we have, to bring awareness to our students, to the young generation that's coming up, they can relate to. So we set up briefs, be it a fashion, graphic, interior designer, that relates to any social and health issues. So the designers around the world are they have adjusted to whatever happened with the pandemic and have come up with ideas to showcase how problems are happening in society in terms of fashion, and this is what visual impact can do, fashion can do. Thank you. Dr. Asha, you want to add?
Yeah, of course. And Gabrielle, did you wear anything from the design? No, not.
Yes, there's Gabrielle, also our designer here. There's Dina as well.
Dina.
So you're young designers who are here.
Thank
So
you very much. It
you.
was really great. And of course, I'm so happy about this partnership as well with your organization, Fashion Design Institute of Mauritius, and all the designers that you introduced to us. We had a fantastic designs that promote different topics. One of them was promoting health lifestyle and sustainability, and another one, Gabrielle, was girls' education. Yes. And also very nice designs that we received, and you will see all this in the TV show that we are going to broadcast very soon, 15 episodes to address different topics of social and health issues. Here I emphasize and I believe strongly in the role that media, fashion and art plays to sensitize communities. We believe in this very, very strongly, and we will always support and partner with media, fashion, art, with our music, filmmaking and all types of art to raise the awareness and to deliver strong messages in visual and vibrant way that can attract people's attention, open a dialogue, and everyone will ask, why are you wearing this? What does this means? And then they start to talk about it and normalize it.